Welcome. My name is Dr.E.Adriana Wilson. I'm a psychiatrist. Through my work, I've been struck by the difficulties we face in providing optimal access to mental health care. We currently operate out of an approach that is disease and deficit-driven, expert-driven, and hospital and clinic-driven. As a result, when someone is struggling mentally or psychologically in their life, we send them the message that there is something wrong with them. Hence, the deficit model. Understandably, this increases stigma and reduces the chances that they're going to ask for help when they need it. When they eventually do ask for help, there tend to be more complications and worse outcomes because of the delay. Then we tell them they need to see an expert. An external person like a psychiatrist, a psychologist, or another mental health professional who has all of the knowledge and control about what happens next. Our reliance on mental health professionals for the answers creates an external locus of control, which we know from the literature is associated with poor coping and worse mental and physical health outcomes. It also decreases patients' investment and engagement in taking responsibility for their own care. And the only place they can access these experts is in hospitals or in clinics. So in short, we are relying on a very limited and expensive resource. And the only way to increase these resources is to increase the number of experts that we train and pay, and the number of clinics and hospitals for them to work at. This is an expensive undertaking for any one system to shoulder. Consequently, we have long wait times, and this forces the system to become crisis-driven, making it reactive instead of proactive. Despite all of the evidence supporting the long-term healthcare savings and the mental and physical health benefits of prevention strategies, we end up only being able to treat patients when they are sick, so during their illness, and at best for a period after for maintenance. As in most crisis-driven systems, there are frequent changes as the system tries to flex and adapt to the ever-increasing demands. As a result, there are unclear expectations, both for patients and clinicians working in the system, as clarity about goals and roles of treatment continually shift. Not surprisingly, communication often also breaks down during a crisis, causing delays in communication about what resources are actually even available at any point in time. The combination of these factors contributes to decreased quality of care, as the time allowed for optimal case management is reduced, contributing to decreased job satisfaction and burnout in mental health care workers who want to provide quality care. Burnout increases clinician turnover, which leads to poor continuity of care. This situation is aggravated even more by the continuous pressure on the system for rapid discharges in order to manage wait lists, often to inadequate or suboptimal community resources or supports. As you might expect, insufficient resources paired with poor continuity of care leads to worse outcomes, higher relapse rates, and an even greater need for more experts, hospitals, and clinics. So when we look at the big picture, it's clear why we have a mental health care crisis in Canada. We have caring, committed clinicians and staff who want to make a difference, but get stuck in a system that is struggling to effect lasting and meaningful change. I believe the solution is not in increasing the number of experts or clinics, but rather in enhancing our current model by creating a new branch of psychiatry, one that is focused on studying the neurobiology of wellness and prevention, and promoting and disseminating this information to the frontline workers, those who are the first point of contact for people with mental health care issues. This would be the role of positive psychiatry. The approach of positive psychiatry is a resilience and wellness-based, capacity-building, and decentralized model. Its aim is to promote and understand physical and mental health before, during, and after illness through the application of psychosocial and behavioral interventions founded in neurobiology and science in order to promote resilience. The foundation of resilience lies in the belief that we are inherently well, and that our experience of mental and physical symptoms is a result of negative feedback by our bodies telling us when something is off track and needs to be addressed. Promoting a resilience model will reduce stigma and encourage patients and clinicians to focus on the social determinants of health. It would also increase patient accountability and foster an internal locus of control as they're encouraged to reflect on what aspects of their life may be out of balance. Similar to positive psychology, an important part of our role in positive psychiatry is to study wellness. In our case, specifically the neurobiology of wellness. in order to promote and disseminate this information for capacity building in the frontline workers, like teachers, clergy, GPs, pediatricians, and therapists. By promoting and disseminating the tenets of positive psychiatry across professions, we can distribute the mental health care costs across multiple systems. The decentralized model of positive psychiatry will also seek to expand and explore the use of technology as a means of increasing access to mental health care resources. This distributed approach will likely reduce wait times as well as the acuity of presenting patients. Consequently, it will likely reduce the burnout in clinicians, further increasing the quality and continuity of care in our existing system. Positive psychiatry will also bolster existing community resources and facilitate more primary, secondary, and tertiary prevention strategies. Clinicians and scientists throughout the world are already studying the neurobiology of wellness and applying those findings clinically. The Association for Positive Psychiatry of Canada is an organization where like-minded individuals can connect, collaborate, share, and inspire one another, and where partners can gain access to valuable training and resources. We are an inclusive organization, so we welcome both Canadian and international members and partners. I'm inviting you to join our website at www.appc.ca. Become a member or a partner. Share an idea or your resources, but most importantly, share the information. Let's find out what wellness is all about and spread the word.